Hello and welcome to the Skin Cancer Education module. In this module, you will learn about the most commonly seen skin cancers in solid organ transplant recipients, how to recognize these skin cancers, and the steps you can take to decrease your risk. We will start off with a quick introduction. Skin cancer is the most common type of cancer seen in organ transplant recipients. It occurs due to the immunosuppressive drugs that you are given so that your body won't reject the transplanted organ. Oftentimes, there is a lag time after your transplant surgery before skin cancers develop. This makes it very important to regularly examine yourself for new moles or lesions. Some commonly seen skin cancers are melanoma, squamous cell carcinoma, and basal cell carcinoma. Of these three types, squamous cell carcinoma is the most common type of skin cancer in the transplant population. This population is 64 times more likely to get squamous cell carcinoma than the general population. Now we will look at these three types of cancers in more detail. Let's start with squamous cell carcinoma. Squamous cell carcinoma often appears as red patches, open sores, or as warts. These cancers can have a crusty appearance or bleed easily. They are most commonly seen in areas of the body exposed to the sun, such as the lower lip, face, scalp, neck, hands, arms, and legs. These pictures show the features described in the previous slide. The first picture to the left shows a pink-colored papule with a yellow crusty appearance on the back of the hand. To the right, we see a pearly, almost translucent purple nodule with an adjacent crusted ulcer-like sore on the forearm. The next type of skin cancer we will discuss is basal cell carcinoma. Basal cell carcinoma is the most common type of skin cancer in the general population. Remember that squamous cell carcinoma is the most common type of skin cancer in the transplant population. Similar to squamous cell carcinoma, basal cell carcinoma can look like open sores and red patches. However, they can also appear as shiny bumps or scars. These lesions rarely spread beyond the original site to involve other locations. In this slide, we have two pictures of basal cell carcinoma. The first to the left shows a dome-shaped, shiny bump. The second to the right shows an ulcerated depression that has some blood in the center. The third type of skin cancer we will discuss is melanoma. Melanoma is the most deadly type of skin cancer, and this is due to its ability to spread and involve many organs. Melanomas can resemble moles, or they can develop from moles. The majority of melanomas are black or brown, but these can also be skin-colored, pink, red, or other colors. Most melanomas are caused by intense ultraviolet exposure, usually from the sun. Melanomas are almost always curable if found or treated early. This explains why it is so important to catch and treat melanomas early. A common way to remember the appearance of melanoma is the ABCDE rule. The A stands for the asymmetry of these lesions. B stands for the border, which is often uneven or irregular. C stands for the multiple colors that can be present. D stands for the diameter, which is typically larger than a pencil eraser in size. E stands for the evolving nature of melanoma, meaning that these lesions are very prone to changing in size, shape, or color. Let's take a look at these features on this photo. This photo shows a melanoma which has asymmetry, a jagged, wavy border, multiple color shades present, and a diameter larger than a pencil eraser. The melanoma is very likely to change in appearance at a future time point. Next, we will talk about some of the ways that you can reduce your risk for skin cancer. This entails practicing safe sun exposure, which includes avoiding midday sun between 10 a.m. and 4 p.m., using sunscreen, and wearing sun protective clothing such as long-sleeve shirts, pants, sunglasses, and a hat. As mentioned in the previous slide, using sunscreen can reduce your risk of skin cancer. Applying sunscreen properly can reduce your risk of getting melanoma by 50%. To get the maximum benefit from sunscreen, you should apply a broad spectrum sunscreen with a high sun protection factor of at least 30. Reapply the sunscreen every 2 hours when outdoors, especially if swimming or sweating. Apply sunscreen to all sun-exposed skin areas, for example, including your face, arms, legs, and neck. And use enough sunscreen, which is approximately the amount to fill a shot glass, or 1 ounce. This brings us to our final slide. Since you are at a higher risk of getting skin cancers, you should plan on visiting the dermatologist at least once a year. However, if you have any past history of skin cancers, you may need to follow up more frequently. If you have any suspicious skin lesions, moles, or in any doubt, follow up as soon as possible. Thank you for taking this module. We hope that you have found it useful and that you can apply some of these concepts in your day-to-day life. Goodbye.